Okay, so let's quickly run through the endocrine system anatomy. Anytime we say endocrine system, we know that we are talking about endocrine glands and the hormones that they produce. The endocrine system consists of glands that secrete hormones directly into the bloodstream. These glands do not have ducts, they are ductless glands. So unlike the exocrine glands that have ducts, the endocrine glands are ductless glands. And this is why they secrete their hormones directly into the bloodstream. Unlike the exocrine gland that secrete into ducts. An example of exocrine gland are the salivary glands, and these have ducts. They secrete into ducts and not into the bloodstream. Hormones are carried through the blood to their target tissues and organs, and these hormones generally influence cell growth and metabolism. The major endocrine glands that we have in the human body include the pituitary gland, thyroid, parathyroid, adrenal, pineal, pancreas, ovaries in females, testes in males. So let's talk about the relationship between the hypothalamus and the pituitary gland. We'll come back to this table. The hypothalamus and pituitary gland work together to regulate most endocrine glands. The pituitary gland is divided into two. We have the anterior pituitary, otherwise known as the adenohypophysis, and we have the posterior pituitary, otherwise known as the neurohypophysis, and each of these parts secretes their own hormones. The anterior pituitary releases hormones like growth hormone, thyroid stimulating hormone TSH, adrenocorticotropic hormone ACTH, follicle stimulating hormone FSH, luteinizing hormone LH, and prolactin. You see, these hormones, their release is controlled by the releasing hormones that the hypothalamus produces. So if we go back up, you'd see that for TSH, the hypothalamus produces thyrotropin releasing hormone, and this stimulates the anterior pituitary to produce thyroid stimulating hormone and also prolactin. Okay, then for the luteinizing hormone and FSH that the anterior pituitary produces, the hypothalamus releases gonadotropin releasing hormone before these hormones are produced. Then for the adrenocorticotropic hormone produced by the anterior pituitary, the hypothalamus has to release the corticotropin releasing hormone before ACTH will be released by the anterior pituitary gland. Growth hormone inhibiting hormone is also known as somatostatin, and prolactin inhibiting hormone is also known as dopamine. The posterior pituitary releases hormones such as antidiuretic hormone and oxytocin. The antidiuretic hormone is also called vasopressin. The posterior pituitary gland in itself does not synthesize or produce these hormones. It just stores and releases them. These hormones are produced in the hypothalamus. The antidiuretic hormone and oxytocin are produced by the hypothalamus, but they are stored in the posterior pituitary, otherwise known as the neurohypophysis. So the specific hormones that we have, growth hormone, as the name implies, it promotes growth and metabolism, and its release is stimulated by GHRH produced by the hypothalamus, and GHRH is growth hormone releasing hormone. Prolactin to stimulate milk production so that the mother can breastfeed the child. This hormone is regulated by dopamine. Don't forget, we mentioned earlier that dopamine is also known as prolactin inhibiting hormone, PIH. Thyroid stimulating hormone, TSH. The thyroid stimulating hormone stimulates the thyroid gland to produce thyroid hormones, and there are two thyroid hormones: thyroxine, otherwise known as T4, and triiodothyronine, otherwise known as T3. So let's take a look at the adrenocorticotropic hormone. Adrenocorticotropic hormone is a hormone produced by the anterior pituitary gland, secreted by the anterior pituitary gland in response to CRH that is produced by the hypothalamus. Now, what does ACTH do? ACTH stimulates the adrenal cortex to release glucocorticoids. So ACTH levels are highest in the morning and decrease throughout the day. It is also influenced by stress, sleep patterns, and other factors. Let's talk about the gonadotrophins, the FSH and the LH, follicle stimulating hormone and luteinizing hormone. We call them gonadotrophins because they work on the gonads. And you know that gonads means sex organs, so they work on the testes and on the ovaries. Follicle stimulating hormone and luteinizing hormone are secreted by the anterior pituitary gland. FSH stimulates the production of gametes. So for the follicle stimulating hormone, it stimulates the production of sperm in males and the production of ova in females. Luteinizing hormone stimulates the production of sex hormones, testosterone in males, estrogen and progesterone in females. Let's talk about the hormones of the posterior pituitary gland. The posterior pituitary gland releases oxytocin and antidiuretic hormone, ADH. I've said it earlier, that is otherwise known as vasopressin. Oxytocin from homeostasis that we talked about. Oxytocin stimulates uterine contractions during parturition, during childbirth, and it also stimulates milk ejection during breastfeeding. ADH, antidiuretic hormone, regulates water balance. It increases water reabsorption in the kidneys, concentrating the urine. It generally helps to conserve water. When there is a problem with the antidiuretic hormone rather, then if it's hypo condition or hypo disorder, then you begin to urinate too much, and this is what we refer to as diabetes insipidus. Diabetes insipidus is as a result of deficiency of antidiuretic hormone. The thyroid gland is located in the neck, and the thyroid gland produces the thyroid hormone, thyroxine, T4, and triiodothyronine, T3, and these hormones regulate metabolism. Thyroid stimulating hormone, TSH, produced by the anterior pituitary, stimulates the release of T4 and T3, and these hormones influence various bodily functions, including growth, development, and metabolic rate. Calcitonin. The parafollicular cells of the thyroid gland also produce calcitonin. So T4 and T3 are not just the only hormones produced by the thyroid gland. Calcitonin is also produced by the thyroid gland. And what calcitonin does is that it lowers blood calcium levels by inhibiting bone resorption and increasing calcium excreted by the kidneys. We have talked about these under the skeletal system. So I believe you already know the role of the calcitonin. It lowers blood calcium, so it causes an influx of calcium phosphate into the bones. Okay, so regulation and feedback, we don't need to talk about this, so let me expunge it. Now you see, most of these endocrine glands, there can be disorders or diseases of these endocrine glands, and these disorders are usually due to hypersecretion of the hormone or hyposecretion of the hormones, and this can lead to various disorders. Let's take a look at hyperthyroidism, which is the excessive production of the thyroid hormones T3 or T4. Hyperthyroidism leads to symptoms like weight loss, rapid heart rate, and heat tolerance. And hypothyroidism, which is as a result of insufficient thyroid hormone production, leads to weight gain, fatigue, and cold intolerance. Now, parathyroid glands, these are located on the posterior surface of the thyroid gland, and they produce parathyroid hormone, which regulate blood calcium levels. Parathyroid hormone increases blood calcium by stimulating bone resorption. It increases calcium absorption in the intestines and reduce calcium loss in the urine. So parathyroid hormone does the opposite of what calcitonin does. It increases blood calcium. The adrenal glands. The adrenal glands are located above the kidneys. There are two kidneys, so we have one adrenal gland on top of one and another adrenal gland on top of the other. So, and what this adrenal gland consists of the adrenal cortex and adrenal medulla. These two regions, different regions of the adrenal gland, produce different hormones. The adrenal cortex produces corticosteroids, glucocorticoids. So adrenal cort, then corticosteroid or glucocorticoid. So please use this mnemonic to understand this. Adrenal cortex produce corticosteroids, and the corticosteroids, there are three. We have glucocorticoids. One, an example is cortisol. We have mineralocorticoids. Two, an example is aldosterone. Then we have androgens. Okay. Now the adrenal medulla produces catecholamines, adrenaline, noradrenaline, and these hormones are crucial for stress response, metabolism, and electrolyte balance. Okay. Let's talk about the renin angiotensin aldosterone system. This system regulates blood pressure and fluid balance. Okay, so this is how the system works. If there's low blood pressure or low sodium levels, these conditions trigger renin release. Renin is a hormone, okay, and when renin is released, aldosterone secretion too also follows, and this increases sodium and water retention, raising the blood pressure. The sex hormones, gonadocorticoids, they are secreted by the adrenal cortex, and they are primarily androgens, male sex hormone, with negligible amounts of estrogens, and these hormones play roles in puberty and adulthood. Okay, let's go to the pancreas. The pancreas has both endocrine function and exocrine function. The endocrine function is carried out by the pancreatic islets and these pancreatic islets contain alpha, beta, and delta cells. The alpha cells secrete glucagon, and this glucagon raises blood glucose level. The beta cells secrete insulin. Insulin lowers blood glucose level. And the delta cells secrete somatostatin, and the somatostatin regulates both alpha and beta cells. Insulin and glucagon regulate glucose metabolism. That's what they do. Okay. The pineal gland. The pineal gland is located in the brain, and it secretes melatonin. That's the hormone that it produces, and this melatonin regulates sleep-wake cycles. Melatonin levels are influenced by light exposure. So when there is bright light, maybe during the day, melatonin levels are reduced, but at night, during the dark, melatonin levels are raised, and it makes us sleep. Like we have said, it regulates the sleep-wake cycle. There are organs in our body that are not primarily endocrine organs, but they have secondary endocrine functions, okay, like the heart, the kidneys, gastrointestinal tract, and adipose tissues. Then there are also hormones in our body that are called local hormones. Okay, so when they are released, they act in the immediate environment of where they are being released, like histamine. And histamine is involved in inflammatory responses and allergic reactions. It's produced by mast cells. Serotonin, it regulates mood, sleep, and other functions. Prostaglandins affect inflammation, muscle function, and more. So, still on the disorders of the hormones, let's consider growth hormone. What happens when growth hormone is in excess? Hypersecretion. And what happens when it is low? Hyposecretion. Hypersecretion, we can have gigantism, okay, and acromegaly. These two conditions depict excess growth hormone production. Gigantism happens in childhood before the fusion of the epiphyseal plate, the epiphyseal cartilages, while acromegaly occurs in adults after the fusion of the epiphyseal cartilages or epiphyseal plate. Hypopituitarism, there will be insufficient growth hormone production. So for thyroid disorders, we discussed it earlier. We said that hyperthyroidism means excess thyroid hormone production, and this can increase metabolism, increase heart rate, its intolerance, and all. Then hypothyroidism means deficiency in thyroid hormones, and it causes reduced metabolism. Other conditions that can affect the thyroid gland include Graves' disease and thyroid nodules. The parathyroid gland, hyperparathyroidism, excess parathyroid hormone will lead to high calcium levels, while hypoparathyroidism will lead to low parathyroid hormone and also low calcium level. So what happens when there's a disorder of the adrenal cortex? We have if we have hypersecretion of glucocorticoids produced by the adrenal cortex, primarily cortisol, we have a condition called Cushing's syndrome. And the causes of this Cushing's syndrome have been highlighted in these notes. The symptoms include moon phase, fat accumulation in the trunk, muscle wasting, osteoporosis, hypertension, and susceptibility to infection. So what if we now have adrenocortical insufficiency, hyposecretion? That's what we call Addison's disease. So in Addison's disease, there is hyposecretion of both the glucocorticoids produced by the adrenal cortex and the mineralocorticoids produced by the adrenal cortex. The Addison's disease is usually autoimmune, and it can also be caused by infections. The symptoms include fatigue, muscle weakness, weight loss, low blood pressure, darkening of the skin. So the mineralocorticoids, like example is aldosterone. So when there's hyposecretion, when there's low aldosterone, this leads to electrolyte imbalances, low blood pressure. When there is excess aldosterone production, it leads to hypertension and low blood potassium. We have discussed the pancreas. We said it has alpha, beta, and delta cells. So let's see what happens when these hormones are not produced sufficiently. We have diabetes mellitus type 1. It is also known as insulin dependent, and is often diagnosed in children and young adults. It's usually an autoimmune disease, and it's caused by the autoimmune destruction of the insulin producing beta cells. So we have type 2 diabetes mellitus. This is non-insulin dependent at the early stage, and it's more common in adults. Okay, so diabetes mellitus has to do with the insulin hormone. The pathophysiology of diabetes mellitus, some of the symptoms, we have symptoms and signs. There's hyperglycemia, high blood glucose level. After meal, there's glycosuria, which means glucose in your urine, polyuria, which means frequent urination or higher volume. Okay, excess glucose in an increased urination. Ketoacidosis, there will be breakdown of fat leading to acidic blood. And there can be hypoglycemic coma. So I gave a table here to summarize all the hormones produced in the body and their functions. So 1, insulin. Insulin is produced by the beta cells of the pancreas, and what insulin does is to lower blood glucose levels. Glucagon. Glucagon is produced by the alpha cells of the pancreas, and what glucagon does is to raise blood glucose levels. Somatostatin. Somatostatin is produced by the delta cells of the pancreas, and what it does is to inhibit insulin and glucagon secretion. Adrenaline, also known as epinephrine, is produced by the adrenal medulla, and it increases heart rate and blood pressure. It also prepares the body for fight, flight, or fright. Noradrenaline is produced by the adrenal medulla too, and it has similar function to adrenaline, but these also cause blood vessel constriction. We have cortisol. It is a glucocorticoid produced by the adrenal cortex, and it regulates metabolism, and is also produced when you are stressed. Aldosterone is produced by the adrenal cortex. It's a mineralocorticoid too. It regulates sodium and potassium levels and blood pressure. Androgens are also produced by the adrenal cortex, and they contribute to sex drive and secondary sexual characteristics. T4 and T3 are produced by the thyroid gland, and they regulate metabolism. Okay. Calcitonin is produced by the thyroid gland, and it reduces blood calcium levels. Parathyroid hormone is produced by the parathyroid gland. It raises blood calcium levels. Growth hormone is produced by the anterior pituitary, and it stimulates growth, cell production, and regeneration. Prolactin is for breast milk, okay, and is produced by the anterior pituitary. It stimulates milk production. Adrenocorticotropic hormone is produced by the anterior pituitary. It stimulates cortisol release from the adrenal cortex. Thyroid stimulating hormone is produced by the anterior pituitary, and it stimulates thyroid hormone release. Luteinizing hormone is produced by the anterior pituitary, and it stimulates ovulation, and sex hormone production. Follicle stimulating hormone is produced by the anterior pituitary, and it stimulates growth of ovarian follicles and spermatogenesis. We have touched almost all these hormones, but let me still take one or two. Oxytocin is released by the posterior pituitary, and it stimulates uterine contractions and milk ejection. Antidiuretic hormone, also known as vasopressin, is released by the posterior pituitary, and it promotes water retention in kidneys. Melatonin is released by the pineal gland, and it regulates sleep-wake cycle. Estrogen is released by ovaries. It regulates female reproductive system and secondary sexual characteristics. Progesterone is also produced by ovaries, and it prepares uterus for pregnancy. Testosterone is produced by the testes. It regulates male reproductive system and secondary sexual characteristics. Erythropoietin is produced by the kidneys, and it stimulates erythropoiesis in red bone marrow, which erythropoiesis means the production of red blood cells. Renin too is produced by the kidney, and regulates blood pressure through the renin-angiotensin aldosterone system. We have other ones. Gastrin. Gastrin is produced by the stomach, and it stimulates the secretion of gastric acid. Secretin is produced by the small intestine, and it stimulates bicarbonate production in pancreas. Cholecystokinin is produced by the small intestine, and it stimulates digestion of fat and protein. Leptin is produced by the adipose tissue. It regulates energy balance and inhibits hunger. Ghrelin is produced by the stomach. It stimulates appetite. Histamine produced by mast cells, and they are involved in local hormones.